I am Dr. Pranavan, consultant forensic pathologist from Teaching Hospital Jaffna. Today we are going to look into the disposal of dead body and inquest in forensic medicine. Can anybody respond? Can you hear my voice clearly?
Yes, sir.
Okay. So we will see the first topic, disposal of death and inquest. So this is the case scenario. We'll start with the case scenario. You are a recently passed out MBBS graduate. You have a friend whose father is terminally ill with a carcinoma, cancer. One day, your friend calls you and tells that his father had died at their home and asks for your opinion on how to proceed with the death. How would you advise your friend? So once you become doctor, even now I may think, there are several calls you will receive like this. This is a practical scenario. Your relative, your friend, your known people, sometimes your friend's friend. If some known people died, they will call you first because they know you are a doctor, especially if you are living in an apartment in Colombo. Somebody died in your apartment, they will call you and ask, Doctor, can you help us? What to do next? So just think this question and think your answer. At the end of this lecture, you will have a full knowledge how to handle the death. So we will move to the lectures. This is the intended learning outcomes. Stay why the death certificate is important. List the people who are eligible to issue the death certificate. List the circumstances under which a medical officer should issue a certificate to medical cause of death. State the law related to disposing the dead body. Describe how the dead body could be disposed legally if a death occurs at the home or in the hospital. Define the term inquest. List the role of each person involving the inquest. List the circumstances under which inquest should be requested. Discuss the procedure in requesting the possible outcome of inquest. So these are the learning outcomes we are expecting after these lectures. You will learn these answer for these learning outcomes. So we will move one by one. Death certificate. Death certificate contribute to the legal record of the death. It can be significant in insurance and inherited matters for the and also for the vital statistic of the country. So you know, death certificate is the last document of the one person. Once somebody dies, the death certificate carries very crucial information for the vital statistics. So ideally, one country's health budget is planned based on the vital statistics, based on the death certificate, which disease causes more death. So they will allocate more money to that prevent that disease or treatment of that disease. So it's a very important proper cause of death and proper record of the death certificate is for the country's development, even for the health allocation. And also for the person who disease relative, also it's very important for their insurance purpose as well as for the inherited matters. So disposal of dead body. How do you dispose the dead body? There are dead bodies can be disposed legally as well as illegally. That is called surreptitious disposal. So legally, you know, according to the law, and illegally. So what is legal disposal? After proper certification of death. So after proper certification of death, it can be a soil burial or with or without coffin or cremation or donation to the medical institute or research. This is called legal disposal of death. So illegal disposal. What is illegal disposal? No medical certificate of cause of death, no death certification by the registrar, includes, so what are illegal certificates? Secret burials, thrown into the waterways, concealment of the death, burning the bodies, dismembering the bodies. So, these are illegal disposal of dead bodies. You dispose the dead body in illegal way. There can be instance of both legal and illegal disposal. So both can happen together. For example, false medical certificate, falsified certificate of medical cause of death, and in case of homicide, you can dump the body with a false medical certificate as a natural death in homicide cases. So it is include both legal and illegal component. So usually we divide the disposal of death into legal and illegal. For the legal disposal, one of the following are required. This is very important. At least one of this is important for the legal disposal of dead bodies. One is certificate of notice of death. That is Register of Deaths form. Form N. We call this as a Form N. Certificate of the notice of death. Certificate of registration of death. That is Registrar of the death issue that certification of the registration of death. The Form R. Either one of this is important, or certificate from the Gramanidalari or the police officer, GS. Famously, GS or the police officer certification. That is called Form O. Certificate from the superintendent of estate. In Sri Lanka, up countries, they have a different setups compared to rest of the country. They are superintendent of the estate plays major roles. Since state those upcountry hospitals are some of the estate hospitals are not under the government. It is run by the superintendents. So they have a different legal setup. So those days, superintendent of the estate empowered to issue the notification of death. With that, you can dispose the dead body. So he can also issue a notification of death. And now we are going to see the doctor's part. If the body comes to hospital or doctor come across these days, certificate of cause of death. That is general practitioner, GPs, who are not attached to hospital, who are working in the peripheries. Once they can also issue a certificate of cause of death. That is called B12 form or Form J. Declaration of death. That is in the wards. When the death occurs in a government hospital wards, declaration of death. That is your HO. Once you become HO, you are going to issue this declaration of death forms. That is B33. And inquiry certificate of death, that B18. This is when the dead body undergoes inquest. Finally, the inquiry ISD issue the inquiry certificate of death. So any of this, you don't need all of this. At least one of this certificate is necessary to do the legal disposal of the death. So you must understand. So it's a very on MCQ points. They will ask a lot of MCQ on this. So last three are the doctor's role: certification of cause of death, declaration of death, inquiry certificate of death. These three are the proper legal things. So in the estate, superintendent can issue. Of course, in some villages, Gramanidalari and the police officers can issue. And certification registrar, if you go directly to the registrar, they can also issue those forms. So for the legal disposals, any of this is important. So what will happen if there's a death at home? The general practitioner, GP, should issue the relevant certificate only these circumstances. So remember, only following circumstances only, the general practitioner can issue a death certificate. Cause of death is known. Cause of death is natural. Has been attending the disease during the illness which caused the death. So he should have attended the disease during the illness which caused the death. Treating the disease during the last 14 days before the death. At least he should have seen the patient 14 days before the death. View the body and no suspicious of foul play. he should have viewed the body before issuing the cause of death, and he should he should be happy there's no suspicious or no injuries, no evidence of foul play. Then only he can go for death certificate. And no suspicious circumstances surrounding the body. So he has to ask the relative and or the neighbors whether there's any suspicious circumstances. If they raise any suspicious, he can't issue the cause of death. And inquest is not ordered. No inquest should be ordered prior to the giving cause of death. So if inquest ordered, if he order inquest, he can give the cause of death. And this is very important. Should not charge free for issuing the certificate of medical cause of death. This is a rule in Sri Lankan Medical Council. Being a doctor in Sri Lanka, you should not charge for a fee for issuing a certificate of cause of death, which is not practiced in Sri Lanka, of course. So these are the circumstances general practitioner can issue the certificate of cause of death. So you should know this. Cause of death is known. Cause of death is natural. Has been attending the disease during the illness which caused the death. Treat the disease during the last 14 days before the death. View the body and no suspicious of foul play. No suspicious circumstances surrounding the body. No inquest is ordered. Should not charge free for the issuing the cause of death. So this is the cause of death form. It has, it is a general practitioner's one. You can see the details of the disease and the cause of death is there, and his signature. Certificate of cause of death, section 31. So a death at hospital, this is very important for us. Once you become an internee, you are going to handle the deaths. Possible outcomes. What are the possible outcomes when there's a death at hospital? Known cause of death, declaration of death. If cause of death is known and natural, you can directly declare the death. B33 form. We'll see what is B33 form. Cause and circumstance of death is unknown, then you have to go for inquest. You don't know the real cause of death and circumstance of death. You have a suspicious about the death, then you have to go for inquest. So inquest can end up in autopsy. So this is the B33 form, which you are going to fill in the future. So if you see, there's a district, hospital, and the ward number. First part is a full name of the deceased and national identity card number. Second part. Third part is a date of death. Fourth part is the age of death. The age, and then sex, 56, and 7th is address, 6, and the race also there, and the divisional secretary division is there. Divisional secretary, so you have to put the which DS sector he belongs to, because this death certificate finally going to register in that DS division. The data is collected from the statistic department of particular DS division. So this is the cause of death. Next lecture is the cause of death. We will discuss how to write the cause of death. If you see immediate cause of death and underlying cause of deaths are there, and contributory cause of death. We will see next lectures how to fill this form. So inquest. What is inquest? This is the most important. Every paper there will be at least 2 MCQ or 1 MCQ related to 1 MCQ. Definitely there will be 1 MCQ related to the inquest. So what is inquest? It is also called inquiry into sudden death. Inquiry into sudden death. That is called inquest. Medical legal investigation into sudden, unexpected, unnatural deaths are called inquest. So medical legal investigation into sudden, unexpected, unnatural deaths. Why it is carried out? To determine cause of death, circumstance of death. So what do you mean by circumstance of death? It could be accidental death, homicidal death, so suicidal death. So accident means the death occur without any intention. Homicidal death means death occur with the intention. Somebody plan and kill the person. Man killed another person called homicide. And suicide is a killing himself. These are the circumstances of death: accident, homicide, or suicide, to determine the circumstances of death. So the purpose of inquest is to find out the cause of death and circumstance of death. It is carried out into the sudden, unexpected, unnatural death. You should remember this carefully: sudden, unexpected, unnatural deaths. So that is the indication for inquest. So this inquest varied from country to country. So this inquest process, that inquiry into the death, varies to country to country. Coroner system. So we are having coroner system because we are colonial countries of UK. So England and Wales, Australia, Sri Lanka, these countries have a coroner system. Medical examiner system. Here the doctor acts as a inquirer. That is exists in USA. Doctor do the inquest. And procurator fiscal system, Scotland has a little different system. And police inquest system, India, Denmark, these countries have a police inquest system. So their system is little different. And magistrate system, some European countries, for example, Italy and other countries, European countries have magistrate. They are magistrate carry out the inquest. Inquest in Sri Lanka. So in Sri Lanka, legal provisions are under this section: Criminal Procedure Code of 1883. So you can see 1883, Administrative of Justice Law 1973, and Code of Criminal Procedure Act of 15 of 1979. These are some law provisions which empower the legal authorities to conduct the inquest. So inquest, we'll go deep into the inquest. It is open to public. Remember, inquest is open to public. There's no hiding. So anybody can take part. Anybody can come to the inquest. It's an inquiry. Any person, interested party, can come to the inquest. Conducted by the death inquirers. So who are these death inquirers? Either magistrate, appointed by the Judicial Service Commission, investigate into criminal deaths. This magistrate specially handle the criminal deaths, or inquiry into sudden death, ISDs. And another name is a coroner, also called as coroner. If you ask old people, they will say coroner. So the new name is inquiry into sudden death, ISD. He is a appointment by the Ministry of Justice, previously called as coroners. So these are the people who carry out the inquest, either magistrate or IST. Remember, this is also very important MCQ. Only these two people are authorized to carry out the inquest, no other people. Either magistrate or ISTs or coroners. So inquiry into sudden death. Qualification. What is the qualification? So qualification, he is a citizen of Sri Lanka, a permanent resident within the relevant division. His age should be 30 to 55 years, and GC or A level with 3 ordinary passes. So here it is very important. If you see GC A level with the 3 ordinary passes, he's a layman basically. Preference given to the bio stream. So basically, he's a normal person without any degree, but he's empowered to carry out the inquest. So those days there is a problem, as it is a political appointment. The ministers appoint the ISTs for their own wish, but nowadays they are conduct some exams, some interviews, and appoint the ISTs. But still, it's a political appointment because these people are appointed by the ministry. Excellent moral character and good mental and physical order. So these are the Code of Criminal Act empower the ISTs to carry out the inquest. So what is the inquest procedure? When a death inquirer receives the information of a person committing suicide, killed by the animal or machinery or by accident, dies suddenly of unknown causes or suspicious circumstances, a death due to homicide or violence, when the IST received the information, how he received the information? The hospital doctors or administrator or GS, grammarian, or the police, security forces, emergency services, member of the public, and report to the deaths to the inquirer. So whenever there's a death occurs which are suspicious, which is non-natural, which are not natural, which are associated with violence, then any of us can inform to IST, area IST, inquiry into sudden death. So they shall immediately proceed to the place where the body of the deceased is and conduct the inquiry. Usually, they can visit to the place with the police and start the inquiry. That is called inquest. So they draw up a report on apparent cause of death, describe the injuries on the dead body as his or her opinion may relate to the cause of death, manner of death, how the injuries have been inflicted. This report is signed forwarded to the supervising magistrate. So this IST, he goes to the death place and write his opinion and send to the magistrate. If there's a suspicion of crime, magistrate should take the proceeding. Once magistrate receives this information, he will look into the case, and if he thinks it's a murder or something very suspicious, he will take over the case. Or if he thinks it's not a suspicious, a natural death, he can ask the IST to carry out the inquest. Inquest by the magistrate. So when the magistrate get involved in the inquest, without IST, magistrate directly comes to the inquest. Magistrate of the jurisdiction is required to hold the inquest in cases of suspected homicide. Whenever there's a homicide, whenever there's a killing, shooting, or assault, or killing, any type of killing, magistrate has to involve in the inquest. Murders, any murders, magistrate inquest. Death in custody. So whenever there's a death occurs in custody, especially inside the police station, within the armed forces, detention home, correction facilities, prison. So it is usually common death in the prison, death in the police, death in the armed custody, detention homes. What are psychiatric hospitals, leprosy hospital, TB hospital? Here, those places, people are not willingly staying there. They are detained there. In psychiatric hospital, psychiatric patients are not willingly staying there. We detain them. So when death occur in a detention places, especially in prison also, the magistrate has to get into the scene and start the inquest. Death in mental hospital, I already, and the leprosy hospital, magistrate or the local magistrate court to require the hold the inquest. So, especially leprosy hospital and prison hospital, mental hospital. So these area deaths should be handled by the magistrate, not by the ISDs. So inquest procedure. If needed, any inquirer can summon any witness. Remember, this is very important. ISTO coroner. They can summon any witness, including the doctor who are treating the person for the inquest process, to give evidence or to produce the document or other thing to determine the cause of death. So IST has all the powers of the magistrate when he conducting the inquest. So he can summon anybody who are related to death to give evidence. So you have to attend. If you fail to attend, they can punish with the 100 rupees fine or imprisonment, not exceeding 3 months. He can ask the person to even imprison through the magistrate court for not attending the inquest. Since it's a legal process, when even IST is a layman person, when he is conducting the inquest, he has all the power of the magistrate. You should understand that. So what happened when death, sudden unexpected deaths occurring in the hospital? Hospital doctors are request an inquest in death where the cause of death is not ascertained. So this is very important for you. Hospital doctors inquest, when they order inquest, when the cause of death is not ascertained. Death due to medical, surgical, or anesthetic procedure or immediately afterwards. So remember, whenever there's a death occurring following a surgery, laparoscopy surgery, open abdominal surgery, or any anesthesia, death following anesthesia, death following endoscopy, ERCP procedures, immediately you have to go for inquest. Death following administration of vaccine, blood, blood products, or drugs. So any death following the administration of vaccines, blood or blood products or drugs, you have to go for inquest procedure. And alleged medical negligence. Nowadays, the hot topic for all the death relative alleged medical negligence. When the medical negligence is alleged by the relatives, the doctor has to order for the inquest. That is to safeguard the doctors for the future potential legal cases. So you have to go for the inquest. Deaths due to animal bites, rabies, or tetanus. So whenever there's a death following animal bite, animal attack, elephant attack, or rabies following stray dog bites, or tetanus, you have to go for inquest. Deaths due to suspicious circumstance. What are suspicious circumstances? Female young patient comes and dies suddenly. There are some injuries on the body. The husband got admitted and died. The wife is claiming he was poisoned by his friends during the party. Or some suspicious circumstances. You have to order for inquest. And remember, the final one is all the maternal death should undergo mandatory autopsy. This is by the order of the Family Health Bureau. All the maternal death, you have to go for inquest. So this is very important slide. You should know deaths where the cause of death is not ascertained, death due to medical, surgical, anesthetic procedure immediately afterwards, death following administration of vaccine, blood products or drugs, alleged medical negligence, death due to animal bites, rabies or tetanus, death due to suspicious circumstances, and all the maternal deaths. You have to order inquest in hospital setup. If you fail to order the inquest, what will happen? If you issue a cause of death, later there will be an inquiry. Or when if there's a case happening, going in the courts, you have to attend the case and give evidence. It's a huge harassment for you. So therefore, remember this condition. You should not fail. Being a medical practitioner in Sri Lanka, you should not give a cause of death under these circumstances. Any poisoning death, you have to go for inquest because unnatural deaths. Roles in inquest. So what are the roles, people roles? Death inquiry. We have discussed death inquiry's role. That is IST or coroner or magistrate. He find the cause of death and circumstances of death. Police officers, they are the investigating officers. They just assist the inquiry ISDs for the investigating, taking statement from the relatives and other people. Hospital director, he authorized the inquest. So when you are a doctor in the ward, ask for inquest, hospital director authorized the inquest. Relatives of the deceased who give evidence. What happened to the disease? What happened at the lab? What are the disease already he's having? And eyewitnesses, the relatives and eyewitnesses, they give evidence at the inquest. And judicial medical officer, finally, we do an autopsy and give the cause of death. Remember, the judicial medical officer only do an autopsy and give a cause of death. We never give a circumstance of death in Sri Lanka. In Sri Lankan setup, JMOs or forensic pathologists only give the cause of death and pattern of injury to the inquiry into sudden death or ISTs. Then IST, based on our cause of death and finding, determine the circumstances of death. So doctor's role is only give the cause of death. Remember that, because it's a MCQ. And any other interested party, this is very important. Any other interested parties can come to the inquest and give evidence. Nowadays, YouTubers or social media influencers, they can also come to the inquest and gives any evidence related to the death. So these are the roles of people in inquest. So IST, police officers, hospital director, relatives of the deceased, eyewitness, judicial medical officers, any other interested parties. So autopsy. When do you do autopsy or dissecting the body? Death inquiry is empowered to call upon medical officer to conduct an autopsy and submit the report of cause of death. So ISTs have all the authority. They can empower to call upon medical officer to conduct an autopsy and submit the report on cause of death. Remember, cause of death. So what is the minimum requirement to conduct an autopsy? He should be MBBS or other acceptable medical degree. So minimum requirement to conduct the autopsy, MBBS or other acceptable medical degree. So if you are an MBBS graduate, you are supposed to do an autopsy. Full registration with the Sri Lankan Medical Council. You should have a SLMC number, full registration. If a dead body is already buried, the exhumation is conducted to autopsy should authorized by the magistrate. So if the dead body is already buried, then exhumation to conduct the autopsy should be authorized by the magistrate, not by the ISTs, remember. So burial should be buried bodies, the magistrate should conduct the autopsies. Custody of dead body. So who hold the custody of the dead body? Who has the custody of dead body? During the inquest procedure, the body of the deceased belong to the state and the relatives of the deceased cannot object the inquest process. This is very important. Remember this, if once the inquest is ordered by the doctor and director authorized, then the body belongs to the state. What does it mean? The relative has no control over the body. Relative can't object for the inquest. You don't need the consent of the relatives to carry out the inquest because the state proceed. So it's belong to the body belong to the state. You can do anything with the or any investigation with the body. The relatives are handed over the custody of the dead body only after inquirer released the body following the conclusion of inquest. Once the inquest is over only, the relatives are hand over to the body is hand over to the relative. Custody of the body is hand over to the relative. So until the inquest is over, body belong to the state. That means state means the government. Government means the government officials, JMOs, police, and the ISTs. These people are holding the custody. Custody of the dead body. So method of disposal of whom the body released is decided by the inquirer. So once the postmortem is over, who to hand over the dead body is decided by the IST or inquirer into sudden death or magistrate. Usually the wife has all the legal rights, or if he's not married, the parents have the legal rights. So anyhow, if there's any conflict, any family issues or conflict, who to hand over the body is decided by the IST following the inquest. Inquiry into sudden death or magistrate following an inquest, not the doctor. Doctor can't decide to whom the dead body is handed over. So it is decided by the IST. Autopsy bodies are usually buried. This is another important. When you do a postmortem, bodies are usually buried in case need a second autopsy arises. Why we bury the bodies? Because in case any suspicious, especially in medical negligence cases, you can go for a second autopsy. Therefore, usually buried. But remember, this is not cultural practice in Jaffna or in any other parts. Sometimes based on the religious ground, they get special permission from the magistrate and cremate the bodies in some parts. So usually buried, you should know. However, relatives can opt for requesting cremation where any suspicious circumstances excluded. Relative can go and ask in the magistrate court. But remember, in a murder case, it is buried. You can cremate the murder cases or suspicious death. This is the custody of dead body. And the consent of next of kin. So I already told, consent from the next of kin is not required for the obtaining the biological sample during the medico-legal autopsy to ascertain the cause of death. So the relatives, you don't need a consent from the relatives in medico-legal autopsies to get a samples during the post-mortem for the analysis. You can take a blood, you can take a urine, or you can take any internal organ for histopathological examination. You can take blood for toxicological analysis. So you don't need any consent from the relative. In medico-legal autopsy, there's another type of post-mortem, pathological post-mortem. We will come for at the end of the lectures. But in medico-legal autopsy, you don't need a consent from the next relatives. However, for the preservation of specimen for academic purpose, remember, not for the legal purpose, but we obtain specimens sometimes to teach the medical students, academic person, non-forensic autopsy conducted for disease diagnosis or research purposes, consent from next is required. So other than determine the cause of death and circumstances, if you obtain samples for research purposes, if you obtain sample for academic teaching purposes, then you need a consent from the relative. Remember, for the medico-legal purpose, you don't need a consent from the relatives. Hope it is clear for everyone. You can raise your hands and you can ask questions if you have any doubts. So what is the outcome of inquest? Apparent cause of death given by the inquirer by the posing available evidence. So at the end of inquest, apparent cause of death can be given by the IST with the available evidence. If not possible, what he will do, he will ask the JMO, judicial medical officer, called upon perform autopsy to ascertain the cause of death. So why we are asking? They are asking to determine the cause of death under investigation open verdict. Sometimes we can't also give a cause of death. In some conditions, for example, in heroin overdose, you have to go for analysis of the blood. If there's a suspected drug overdose, you have to go for analysis. Some natural disease is invisible to the naked eye. You have to go for histopathological examination. You have to go for extensive toxicological analysis in some day. So those things we don't give the cause of death even after the post-mortem. So we give an open verdict. We say under investigation. That is called open verdict. Once all the report is available, we will give the cause of death. So that is the outcomes of inquest. Either coroner can give the cause of death. If he can't, he will ask the judicial medical officer to perform the autopsy and give a cause of death. Sometimes we can't also give a cause of death. We will take some time, 3 months or 6 months, until the analysis of specimens come. So that is called open verdict. So this is a flow chart. Up to now, what we have studied. Now we are going to see up to now what we have studied last 40 minutes. If there's a hospital death, what's happened? The cause of death, either the cause and circumstance of death is known or unknown. So these are two circumstances. No, that's a hospital death. Either cause of death or circumstance is known or unknown. If it is known, what is the issue? The doctor medical officer feels the declaration of death, B33-4, and over. The problem is over. Now the problem starts unknown. If the cause of death is unknown or circumstance of death is unknown, then medical officer requests the inquest from the director for authorization from the police. He will order the inquest and director will inform the police about the inquest. What the police will do, they will go to the IST. They will ask the inquirer into sudden death to conduct the inquest. Then what happened? If the IST can determine the cause of and circumstance death, he can conclude the inquest. He can give the cause of death and finish it off. But it is not always happen. Sometimes IST can't conclude the cause of death, cannot determine the cause and circumstance of it. Then what happened? He orders the JMO to conduct the autopsy to determine the cause of death. So he will order the forensic pathologist or JMO to conduct the post-mortem to find out the cause of death. Then it concludes the inquest process. So hope this is understand to everybody. Hope you got the basic idea what's happened to the deaths in the hospital. When there's a death in the hospital, cause of death circumstances is known, then no issue. Medical officer fills the cause of death and chapter closed. If it is unknown, only problem start. He ordered the inquest, medical officer, then the hospital director authorized the inquest, then informed the police. Police can't do anything. They will inform the IST or magistrate. IST, he will do the inquiry. If the relatives also happy, IST also happy with the available records, he can conclude the inquest by issuing the cause and circumstance of death. But if it is an unnatural death, if it is a suspected death, if it's a suicide or animal attack or anything, then they will go for, he can determine the cause and circumstance of death. He will ask the JMO to conduct the autopsy to determine the cause of death. Then we have to do a postmortem and conclude the inquest. Is it clear to everybody? Any question you can ask? We have studied very important chapter of the forensic medicine. Most practical chapter. Okay. So next is the inquest and organ donation. In current situation, organ donation is the very important chapter. So why inquest has an implication on this? Because most of the brain death following RPAs, you can take some organs, kidneys, liver. Those organs can be go for organ transplantation. But that body has to go for inquest because of a road traffic accident or any unnatural death. Remember, nothing in the act shall, there's a Transplant Human Tissue Act, 1987, number 48 of 1987. Transplant of Human Tissue Act is there. Nothing in this act shall apply to any inquiry held by the IST under Code of Criminal Procedure Code into the death of any person for the purpose of establishing or confirming the cause of death or investigation into the existent nature of abnormal condition leading to such death. Remember, when there's an organ donation, usually JMOs are informed prior to the organ donation because they know this is an unnatural death. This will go for postmortem. So they inform the forensic pathologist as well as coroner that we are going to take following organ. That organ should not involved in the actual cause of death. For example, if there's a head injury, only brain injury will be there. If there's a kidney injury, you can remove the particular kidney for your organ. Of course, they won't remove. You can't remove that organ for the organ donation because that is necessary for the postmortem. So we decide before the organ donation. Remember, in inquest process the organ donation process should not interfere with the inquest process. That is a take-home message. You should understand. Organ donation has no implication with the inquest process. So these are some references. We are going for the pathological postmortem. Okay. What is pathological postmortem? So all this time we have studied the judicial postmortem, medico-legal autopsy or judicial postmortem. Now we are moved to pathological postmortem. What is pathological postmortem? It's frequently asked MC. So pathological postmortem is also known as a clinical autopsy. Is a type of autopsy conducted primarily to determine the cause of death in cases where the death is due to natural causes and there is no legal forensic concern. Remember, pathological postmortem is not a medico-legal postmortem. In pathological postmortem, the treating doctors knows why the patient has died, but he is conducting the autopsy to determine the cause of death, to confirm the cause of death, as well as to see the disease process. It is usually performed with the consent of the next of kin and aim to understand the disease process, evaluating the medical treatment, and contributing the medical education and research. So now it is clear for you. Here, usually cancer patient, for example, lung cancer. When there's a lung cancer in the chemotherapy died, the treating oncologist want to do a postmortem to see extent of lung cancer, which extent it has spread, how his treatment has interfered with the disease, whether treatment is responded, whether the tumor is shrunken with his treatment. So he want to know this for the academic purpose, for the treatment of another patient and medical education. So he can do the postmortem with the consent of the relative. In judicial postmortem, you don't need a consent from the relative. But remember, in pathological postmortem, you need a consent from the relative. Is it understandable to everybody? So this is a pathological postmortem. So pathological autopsies are determine the precise cause of death in case where the disease was under medical treatment or had a known illness. So the patient already has a known illness. We are doing to understand the cause of death. Study of disease pathology and its effect on the different organs. So we are doing this autopsy to study the pathology, disease pathology and effect on different organs. To assess the effectiveness of the medical intervention. We are doing it to assess the effectiveness of medical intervention. Contribute the medical education and research. To contribute the medical education. So this is the purpose of doing pathological autopsy. It has no legal consequence. So who is doing the pathological? Not the GMO. Remember, it is performed by the histopathologist. So histopathologist do the pathological also. When the treating doctor requested, histopathologists do the pathological autopsy, and the treating doctors usually present at the autopsy to see the findings. You should understand, treating doctor should be present at the autopsy. So legal aspect require the informed consent from the next of kin. So the relative must give the informed consent, not mandated by the law unless there's a suspicious unnatural death. That it is not mandated by the law unless there's a suspicious unnatural death. If there's any doubt regarding the foul play, or it become a medico-legal autopsy. Remember, when you're doing the postmortem, if you have any doubt, then it converted to forensic postmortem, which falls under the judicial medical officer. Then you have to inform the coroner, and it will change into judicial postmortem, not a pathological postmortem. So, any questions? I'll give 2 minutes break and we will start with the MCQs. We have 6 or 7 MCQs. Hope we'll look into the MCQs in this section. So we'll start in 3 minutes time. So can you hear my voice now? Okay, we are moving for the MCQs, which is very important for your exams. True or false regarding the inquest system in Sri Lanka? Students, you are going to answer this question and we will discuss. It is a closed inquiry and details cannot be divulged to the public. Any answer from anybody? Just you can answer, no issue. I won't remember your names or anything. What is the answer?
It's false.
Yes, false. Why? I already told you. Inquest is an open inquiry. Anybody can take part. It is not the closed inquiry. And it is divulged to anybody. It cannot be, means false. So it's simple question, simple step. Inquest determine the cause and manner of death. Anybody? Anybody? Inquest determine the cause and manner of death.
It's true.
True. Good. Inquest determine the cause of. I just want to explain something here. In inquest, cause of death is determined by the doctor, especially in postmortems. And manner of death is decided by the coroner. But remember, coroner can determine the cause of death as well as manner of death once he's satisfied with the medical records. But doctor can't determine the manner of death. So, for example, in hanging cases, it will come to the postmortem, suicide, hanging. So, doctor can't write the cause of death as a suicidal hanging. Doctor can only write the cause of death as a hanging or suspended by the ligature. But the coroner will final word it will be suicidal hanging. It is determined by the coroner, ISD. Or nowadays you don't use coroner, ISDs. So inquiry into sudden death is a manner of death. He determines the manner of, he can determine the cause of death as well as the manner of death, but doctor only cause of death. Keep it in the mind, it can come in any way in the MCQs. IST can summon a person who treat the disease during the inquest process. Can the IST summon anybody?
Yes.
Yes, no. I already told in my IST has the power of magistrate. He can summon anybody. So when you practice as a HO, MO, don't ask who is this layman to call me for the inquest process. So you will be in trouble. So IST has all the power of magistrate while conducting the inquest. Remember, while conducting, not while he is going in the road. While conducting the inquest, he has all the power of magistrate. All the inquest process will end up in autopsy. What is your answer?
No, false.
False. Any other answers? Any other ideas? Just you can talk. It will be very interactive. What is your idea? All the inquest process end up in autopsy? No, no. When the ISTs are satisfied with the medical records, he can give the cause of death. So it never, not all the autopsies are, all the inquests are end up in autopsy. Some are end up in autopsy. And inquest mandatory in maternal death, where the cause of death is known.
True.
True, very true, because even the cause of death is known. Even you know the mother died of postpartum hemorrhage. Even you know the mother died of heart disease, complicated pregnancy. You have to do an autopsy. Remember, because this is for the maternal inquiry process. So you know maternal deaths are going for maternal inquiry process, national maternal inquiry. So that for that you need an inquest. So there may be another question we ask: witness suicide. Do you need a inquest? Witness suicide? That means CCTV footage of suicide is there, or somebody jumping from the Kalladi bridge into the water. Do you need an inquest process? Witness suicide. What do you think?
Yes.
It is not.
It's
Is it necessary or not?
It is necessary.
Why do you think it's necessary? Now you have witness, no. You have a CCTV footage. No, according to the law, it is necessary. Remember, whether it's a witness or admittance is immaterial for that. For us, we have to go for inquest. Is it clear to everybody? So we will move to the second question. True or false? Judicial autopsy doesn't need a consent from of the relatives. True or false?
True.
Judicial autopsy doesn't need a consent of the relatives. Any idea?
It's true.
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 Everybody agree, no? Judicial autopsy doesn't need a consent from the relatives. Pathological autopsy need a consent from the relatives.
True.
True.
True, no? Pathological autopsy need a consent from the relatives. Cause of death is determined at the end of the pathological autopsy. That is
False.
true. Cause of death, we know the cause of death, but we determine finally, okay, lung cancer patient died of pneumonia. We confirm the cause of death. You can say false. We already know that. Of course, we already know the cause of death, but we confirm, determine. You understand, no? We determine in pathological autopsy. Okay, that is the cause of death. We determine. IST issues an order for the pathological autopsy. True or false? Coroner issues an order for pathological autopsy.
False.
Everybody agree, no? IST is not issuing order for pathological autopsy. He orders for the judicial autopsies. So pathological autopsy, the treating physician take consent from the relatives, and with the authorization of the director, we are doing the pathological autopsy. There's no consent from the relative. Treating doctor usually present at the pathological autopsy to see the extent of the disease process. What do you think? That is, what is the
True.
answer? Just
It's true.
true. That is what we are doing the postmortem, because treating doctor just want to see what's happening, what happened to his disease. So he is usually present to see the extent of disease. Is it clear to everybody? Any doubt? You can ask. Up to this point, do you have any doubt? You can ask anything, or you can even text me through the chat box. Okay. True or false regarding the pathological autopsy. Now we are moving to the pathological autopsy. There should be an inquest to conduct the pathological autopsy. What do you think?
False.
False. Everybody agree? It is false. Why? Inquest is not necessary to do a pathological autopsy. Can be done to exclude the subarachnoid hemorrhage. This is bit tricky questions. Can be done to exclude the subarachnoid hemorrhage. Of course, when the myocardial patient, infarction patient died following a thrombolization, if you suspect it is the ICH, you know he died of MI, myocardial infarction, but you can do a postmortem to see the findings. So you can exclude the SAH. Okay, so true. Cause of death is not known prior to the autopsy.
False.
What is that?
False. False.
False. I already said it is false because we know the cause of death. We do postmortem to confirm the cause. So we know the cause of death. Okay, exactly. We know the cause of death. We issue the death declaration form and we do the postmortem. Remember, death declaration. So in which condition we do postmortem? Cancer patient, all the intrauterine IUDs. Death today also we did in one hospital, 35 weeks intrauterine death, GDM mother. So we did the autopsy to see any abnormality in the vein. So all the IUDs usually mandatorily undergo pathological autopsy if the parents give a consent. Usually they give consent because they want to see whether the child has any diseases which can affect the next pregnancy. So pathological autopsies are carried out, especially in the intrauterine deaths. So intrauterine death, we do pathological autopsy, main. But we don't know the cause of death. It's an intrauterine death. Can be done any circumstance of death? Pathological autopsy can be done any circumstance of death. Is it true or false?
False.
False.
Very good. False. Why it is false? In unnatural circumstances, you can't do that. Do you agree? Unnatural circumstances. Natural death only you can go for pathological autopsy when the cause of death is known. For example, murder case, you can't do a pathological post. Suicide case, you can do a pathological post. Animal attack, you can't do a pathological. You have to go a medico-legal post. Relatives' consent is not necessary.
False.
False.
Okay, false. It's again coming. Okay. Okay, this is another question I found. In which of the following instance does the inquiry into sudden death do the inquest? Which of the following instances does the inquiry into sudden death do the inquest? Okay. We will see each circumstance. A 35-year-old male had a stab injury in the chest causing death. What is your answer? Anybody?
True.
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 1%
True.
true. 35-year-old person had a stab injury in the chest causing death. There's a little trick here. Who do the inquest here? What is this circumstances? Of course, inquest. What is this circumstance? Very good. Somebody has said homicide, magistrate. Why? You understand? This is the homicide. Homicides are usually done by the whom? Magistrate. Death associated with violence. Accident, not magistrate, but homicide. Okay? Inquiry into sudden death never does this. Usually, yeah, 99%. When if the magistrate on leave, he can order the inquiry. But usually, this is done by magistrate. Is it clear to everybody? Any doubt on anybody have any doubt? You can ask. You are free to ask questions. Okay. Incurable lung carcinoma patient who dies due to fall. It's another good example.
False.
Incurable lung carcinoma patient. He won't survive, but he died due to fall. Now, what is the situation? Do we need inquest or not?
We need.
What is your answer? Okay, chat box. True. One person say true. Any others? Yes, you need an inquest because here the patient died due to unnatural circumstances. He didn't die due to the lung carcinoma. He died due to the fall. So you have to go for inquest. Is it understandable to everybody? So you have to go for inquest. Remember that even a even a ischemic heart disease patient, while walking in the road, just fall and died. There's a laceration on the forehead. You have to go for inquest. Why? You don't know whether he died due to the fall or due to the MI. Understand? So you have to go for inquest. When there are injury, you have to natural disease patient fall and then there's an injury, you have to go for inquest. So you need an inquest. A 20-year-old man hanging inside the prison cell. Good question. What is your answer? A 20-year-old man hanging inside the prison. Take your time and think. The death has occurred inside the prison. So who carry out the inquest?
Magistrate.
Magistrate.
Magistrate. So can the inquiry into sudden death carry out the magistrate inquest? No. Custody death. Very good. Somebody answer. Custody. Cisari has answer. So it has to be inquiry into sudden death. Is wrong. Magistrate has to. It's a very good question. Inward patient died due to diagnose COVID-19. Who can do it? Doctor has ordered the inquest. Doctor is afraid to go near the patient and give the cause of death relative, so he ordered the inquest. Who can do the inquest? Inward patient died due to COVID-19. Diagnose COVID-19. IST. Here no issue, no. Here inquiry into sudden death can do the inquest. You don't need to. Is it agree? Everybody agree this? Here there's no issues. He diagnosed COVID-19. A patient undergoing colostomy surgery dies in the operation theater. Now what is the problem? Patient undergo colostomy surgery dies in the operation theater. Medical negligence allegations. In this situation, IST can do an autopsy. Remember, medical negligence, there's no provision in the law, should magistrate do. Okay, but coroner can order, ask the magistrate, can you take over the case because I can't handle the case. But remember, coroner can do the postmortem. Is it understandable? Death following surgery, death following anesthesia, it is better if the magistrate do the postmortem. But coroner can do. If the relative say we don't have any issue, he already ill, and then no issue, IST. So IST can do a autopsy. Any questions? Anybody have any questions? This is a very good question. If you understand this question, you are very clear about the inquest. Anybody want to ask any question? Okay, we are moving to another question. True or false regarding the medico-legal duties of the medical officer? Okay, this is a little common question. True or false regarding the medico-legal duties of the, probably last question, medical officer. A dying declaration of the patient should be obtained without delay. What do you think? Just use your just common knowledge and take. Dying declaration of the patient should be obtained without delay. What is the answer? Anybody? Anybody? One
True.
say false. True. So what is dying declaration? Anybody have any idea? If you have that idea, you will understand. Dying declaration is the statement from the patient at the terminal ill state. When somebody, for example, burn case, 90% burn patient comes to you, you are a HO, you are the first person in contact person. You know this patient is not going to survive. You know more than 40% burn. unlikely to survive. 90% burn, 100% going to die. But patient is talking. So then what is your first duty? Record the statement of the patient on his own verdict. That is called dying declaration. In the law, it is believed that dying patient never lies. So once you record the statement of the patient, the date, time, and what he has, and signature of the patient is better. But with a witness, if you do, that statement is valid after patient death. Nowadays, you may have heard so many burn cases. Pregnant mother died after birth. The relatives alleged he was burned by the husband. But the dying, when the dying declaration is there, the wife says, "No, I did this on my own due to family issue." That is enough to safeguard the husband. So remember, dying declaration you must take immediately after the admission to prevent. It will help for the legal process. It will help to sort out so many issues. Because after half an hour, 1 hour, patient may die. For example, cut injury to throat, gunshot injury to abdomen. Patient is going to the surgery. The surgeon, you are not sure about the outcome of the surgery. Okay. So immediately you have to write down the dying declaration. Is it clear to everybody? So that is true. A declaration of death form should be filled after death following firearm injuries. What is the answer? Anybody? Anybody? You can send the chat box also. Declaration of death form should be filled in after death following firearm. So if the firearm injury following death, what is that? Unnatural death. I agree. Unnatural death, do you fill the declaration form? False. So you don't need to fill the declaration. You are ordering the inquest. The coroner will do that. So declaration form is not filled in inquest process. That's a take-home message. So the B33 form, cause of death form, filled only in natural deaths, not in a unnatural death. This is an unnatural death. This is unnatural death. So you can't fill the declaration form. Is it clear to everybody? If you understand this, that is more than enough. So you can't fill the cause of death form when you order inquest. So firearm injury death, you have to order the inquest. So no need to fill the cause of death form. Hope you understand. Any questions? All are silent. Okay. All the foreign bodies removed during the surgery of the trauma victim should be documented the bedhead ticket. Take your time and think, what is this? All the foreign bodies removed during the surgery of the trauma victim should be documented in the bedhead ticket. True or false? You are doing a surgery and removing a bullet from the abdomen. Will you write down your bedhead ticket? I have recovered a bullet or not? It is true because bedhead ticket is a legal document. Whatever you are doing the patient, you have to write down the bedhead ticket. So you have to write down. It's true. Is it understandable? Can you hear my voice? People are dead silent. You have any doubt on this question?
No, sir.
No, sir.
So you have to write down the bedhead ticket, what you have recovered from the body. In alleged poisoning cases, antemortem sample should be discarded. Should not be discarded without consulting the judicial medical officer. So it's a straightforward question. So whenever there's a poisoning case come, what are sample you take? You take the gastric content, vomit test, you take the urine, you take the blood, and you label it and keep in the fridge for next day to hand over to judicial medical officer or police officer for the investigation. When there's a alleged poison, will you discard that sample without informing the judicial medical officer? What is the answer? You should not.
False.
So it is true. Should not be discarded. So it is true. You understand? So being a medical officer, it's a general note. You should not discard the samples without consulting the judicial medical officer. Inquest should be requested when relatives of the deceased are not present at the time of death in the medical wards. Okay, this is a very good question. Practical scenario. Usually doctors are lazy. When there's a death occurs and no relatives, what do? Okay, order inquest and go to the quarters in the midnight. What do you think? This is true or false? If the relatives
False.
are not there, will you order inquest? Is there any indication like that? No, false. Once the relatives come, you have to explain, and you have to, if it is a natural cause of death is known, you can fill the death declaration form and give it to the relatives. Do you understand? Everybody agree on this? Please don't do this, but remember, most of the medical officers do this because this is very easy to order the inquest rather than writing the cause of death. Writing a cause of death is a harassment. You have to take the details, you have to write a form, you have to write two forms. You need some time to write the cause of death. So instead of that, what do? They just order the inquest. Don't do that. It's a huge harassment for the relatives. So this is false. Everybody agrees?
Yes, sir.
Okay. I think this is the last question. This is the last question. This is the last question, hopefully. True or false regarding the death investigation in Sri Lanka? IST conducts an inquest of the death in the prison. Quick, what is the answer?
False.
False.
False. It's a magistrate. It is mandated to give the family consent to do a pathological autopsy.
True.
True.
True. We have seen now. All deaths within 24 hours admission to the ward need an inquest. Very good question. I forgot to mention.
False.
False. Very good. You are very good. But remember, ask your seniors, they will say death within 24 hours, you need an inquest. That is a wrong concept in Sri Lankan setup. Why we think like this? Because we study all the sudden death, we have to do inquest. And later we study what is the definition of sudden death. Death within 24 hours is sudden death. Then what we implies, okay, all the death within 24 hours, you need an inquest. That is wrong. Even patient get admitted and died within 10 minutes. ECG shows ST elevation MI. You can give a cause of death because you have evidence of cause of death. Remember that. Death within 24 hours need a cause of death, need an inquest is a wrong statement. Still practice most part of the country. At least once you become doctors, don't practice this. When the cause of death is known in homicidal death, cause of death certificate can be issued. I already discussed. When the cause of death is known in homicidal death, cause of death certificate can be issued. What is the answer? I want to hear from you.
False.
False.
False. Now you understand, no? We already discussed it. When the cause of death, homicidal, suicidal, accidental death, you can't issue the cause of death. You have to order for inquest. Sudden natural death due to cardiomyopathy is confirmed by the histological examination. Of course, true. You may know this cardiomyopathy. What is cardiomyopathy? Abnormal cardiac condition where the left ventricle is abnormally thickened. Septal thickening is more than the free ventricular thickening. So it has to be proved. You can measure macroscopically and histologically you have to prove by looking at the hypertrophy of the left ventricular muscles as well as disarray of the ventricular muscles. So it is confirmed by the histological examination. One of the leading cause for sudden death in young people, young athletes, first presentation is sudden death when people are having this type of cardiomyopathy. It is also known as HOCM, hypertrophic obstructive cardiomyopathy, HOCM. Study about this is very important for forensic. So you have to prove with histological examination. So that's all I hope. Another one. True or false? Which of the following are true or false regarding the inquest? Again, very good question. Gramanadari conducts the inquest in rural areas. Who conduct the inquest in rural areas? What is the answer? Anybody?
True.
Why it's true?
ISD.
I don't know. IST, it's false. Jeruban is correct. Because inquest can be conducted by only two people, either IST or magistrate. But remember, Gramanadari can issue the notification of cause of death. Okay? He can't do the inquest. Inquest is completely different. Understand? So Gramadari, for the help, he can say, oh, this patient is died and you can notify the disease. That is not inquest. Inquest is done by the ISTO magistrate, not the magistrate. Okay? Consent of the relative is mandatory. False. Okay.
False.
It's repeating. It is confidential inquiry. Repeating. False. I already, it's an open inquiry. The inquirer comes into the site where the body lies. True. Remember, whenever death occurs in a roadside or in the home, IST has to visit the scene. It's called scene visit. He has to visit the scene and do the inquest. The inquirer has the right to summon the GMO to the inquest. True. After he can request the GMO to do a postmortem. So he can summon. Okay. Thanks.